Good afternoon, everyone, and welcome to Pediatric Practices Survival Checklist COVID-19 Recalls via the DAR. Today, we're going to look at several ways so that we can reach out to our families during the social distancing period in our states to ensure that our patients are getting the health care they need. In addition to providing an excellent level of care to our patients, this can also help to drive up practice revenues during this period of slowdown of patient scheduling appointments. Just a few housekeeping items before we get started. Please submit all questions throughout the event by typing your questions in the questions box located in your GoToWebinar toolbar. Questions will be answered throughout, and any that we are unable to get to will be sent in a follow-up communication. In the session today, you're going to learn about the following. You'll learn how to create and filter a patient demographic list, or PDL, how to send out birthday cards with well visit reminders, understand how to create recall lists for clinical recalls, vaccine status recalls, and care plan recalls, and how to use the patient message exchange to send recall messages to families based on preferred contact method or contact method defaults. Activity 1, general messages and recalls. Our scenario for this activity will be that the practice wants to send out birthday messages to our patients next month as a nice personal touch. This also gives us a chance to remind mom or dad that a well visit is coming due. Let's take a look at how simply and easily this can be accomplished using the demographic analysis and recall. This must be done before running any recall. We must create a PDL, or a patient demographic list. Once the PDL has been created, you can then filter or group the result to further narrow down your field of patients. For this scenario, we want to reach out to all kids with a birthday in a particular month. So we'll include all active patients with no date restriction. We can then choose to narrow down those results based on any of the data available there. Some of the more commonly used data points would be age, PCP, VFC status, insurance carrier, or zip code. For now, let's hop over to OP to see how this is going to be done. I'm going to go ahead and navigate to my practice management in the ribbon, and then to our demographic analysis and recall. We want to make sure that our active patients only box is checked. And for this, we said we're not going to put a date restriction on it. So I'm going to go with no date restrictions here. Then I can press search to bring back all of the patients that are active in my practice. For our selected scenario, we want to narrow down the results to patients that were born in a specific month. Let's say that for this exercise, we want to send out birthday cards to patients that are born in the month of June. In order for us to do that, I'm going to need to add the birthday field. I can do that by clicking on the hamburger menu to the left of the patient ID number. This menu shows all of the available fields for the PDL. The items that show a checkbox are in our view already. The ones without a checkbox are not. We can completely customize this to show data for whatever purposes that we might need. I'm going to go ahead and add our birthday column. You can see now we have this data column here. If we hover over birthday, we can see the filter funnel right here. If I go ahead and click on here, it gives me the ability to filter down my results. Now, rather than clicking on all the different boxes that say June, we're going to go ahead and create a custom filter so we can save time and not miss any. We're going to leave the filter set to like, and then I'm going to type in June. It is important to make sure that the J is capitalized here, as spelling and capitalization will count when we create a custom filter. And then I'm going to add a percentage sign at the end. This use of the percentage sign is called using a wildcard. It means that we want all values that start with June and have any other numbers after it. We can use custom filters for a number of different scenarios, saving time as well as making sure we didn't forget to click anything. I'm going to go ahead now and click OK. We can see now we have 267 patients, down from 3,300. Everybody that's born in the month of June is now listed. If we like, we could continue to filter or group this list by zip code, by PCP, or any other available fields. Once you've filtered down your list, you're ready to go. We could now print the grid if we were going to use this internally to contact patients. We could print letters if you have a general letter that you'd like to send out. We can send messages to use the patient message exchange, or reach out based off of family contact preferences, or export to an Excel spreadsheet to save this list in a Google Sheet, Excel, or CSV format. A few takeaways from our first scenario. We can now use the PDL to create lists of patients for any of the sortable fields. We can make lists based off of a patient's birth month, age, insurance carrier, or zip code. These are just a few examples. Or we could use combinations of different values to create PDLs that you can use to reach certain populations within your patient base. Activity 2, creating a clinical recall list. For this scenario, the practice wants to recall all of its persistent asthma patients that haven't been into the office in the last 6 months. Let's take a look and see how we can reach out to encourage our patients to return to the office. We're going to create a patient demographic list to search using active patients only and at least one visit in the last 3 years. Let's again navigate over to OP and see what that's going to look like. Once more, I'm navigating to practice management and demographic analysis and recall. I've got my active patients only selected, but I do need to change my at least one visit since. I'm going to set that to 3 years previous. We use this date because anything past 3 years, when they return to the office, it would be considered a new patient visit. I only want to recall my established patients for this. Once I have that information populated, I can go ahead and hit search to generate my PDL. After generating the PDL and placing in any further desired filters, we will navigate to our clinical recall tab. When we get to the clinical recall tab, we want to verify that our date range pulled over correctly. For this recall, we're going to go ahead and select our problem list. I'm then going to click the drop-down menu here to select all of my persistent asthma problems. So we want our mild persistent asthma, our moderate persistent asthmas, just persistent, and severe persistent. Once I've selected all of the items that I want to include, I can go ahead and click search. Once my search completes, we have our list of patients that have an active problem of either mild, moderate, or severe persistent asthma. Now let's get this narrowed down to just patients in this list who have not been seen in the office for at least 6 months. To do this, we'll need to locate the last visit date column on our grid. I'm going to go ahead and click our hamburger menu again to see if that is an available field. Down towards the bottom, I see that my last visit date has been added, but it's not viewable on my screen without having to scroll. I'm going to just remove a couple of the different fields here that I don't feel are going to be necessary for my report. And now last visit date is a viewable item in my screen. I'm going to hover and select my funnel again to filter by last visit date. I'm going to again create a custom filter. Our value is going to be less than or equal to. And we said we wanted to recall patients that haven't been into the office for 6 months. So I'm going to go ahead and populate November 1st of 2019. So my custom filter basically is saying that any patient who has not been seen, we want to go ahead and pull those. We can see now that the patients of a last visit date of 9/5/2017, 6/9/2018, and 5/5/17 and 5/11/17. We can now go ahead and recall our patients. So what did we learn in this activity? We learned how to generate a clinical recall list based off of active problems, medication allergies, medications, lab results, or any combination of those 4 items. We then learned to further use grouping, sorting, and filtering to narrow down or organize these results using the same skills that we learned in Activity 1 on the patient demographic list. A possible takeaway action plan for your office to consider. Create recall lists for patients with asthma, ADHD, diabetes, and then maybe use other categories to zero in on specific patient groups within those, taking maybe a specific medication, high or low test results, or patients that have not been in the office in a certain time frame. Activity 3, creating a care plan recall list. We have a very straightforward but very effective scenario for this activity. How many patients are due or overdue for a well child check? In this activity, we'll be creating a recall list by leveraging care plans. All practices have access to the Bright Futures Care Plan in OP. As a practice, we want to do the very best we can to keep our kids healthy and up to date on their vaccinations and other diagnostic tests that occur within the regularly scheduled well visit. Having our patients come in for their regularly scheduled visit also helps to keep the practice revenue streams healthy. Again, we're going to create a patient demographic list to search using active patients only and at least 1 visit in the previous 3 years. The difference is that this time we're also going to exclude patients with appointments. Patients with appointments can be notified when those families come into the office. I'm again going to go ahead and navigate over to OP and take a look at how we can do this. Within my practice management, I'm going to navigate to the demographic analysis and recall. I'm going to build my PDL with active patients only. That have had a visit since 2017, and we're excluding patients that have an appointment. Search. After generating our PDL and placing any additional desired filters, we're going to navigate to our Care Plan Recall tab. We're going to use the Recall Plans dropdown to select the Bright Futures Preventative Care Plan from the list. Next, in the recall item, we're going to select Preventative Encounter. Instead of using the dropdown, I'm just going to start typing rather than having to search through the drop-down menu. We're not going to use any of these checkboxes here, but I do want you to have a good understanding of how they can be used. The All Qualified box will include patients that are not currently enrolled in the care plan, but do qualify for it. We would generally use this for any of our auto-enroll care plans. With an auto-enroll care plan, the patient does not get attributed or enrolled to the care plan until we open up that patient's chart. So there can be instances with a asthma or ADHD care plan where a patient may qualify for the care plan but not yet be enrolled. Comorbid is only used when recalling patients using more than one care plan. What this box means is that when recalling patients using at least 2 care plans, the patient must be enrolled in both care plans to qualify for the list. They can't just belong to one or the other, they must belong to both. And then last, are include if due for any item in the care plan. This is used to recall patients not based on any one particular item in the care plan, but for patients that have any portion of the care plan overdue at all. For example, if we use this with a Bright Futures recall, it would return with patients overdue not just for well visits, but also anybody who is overdue for a lead or hemoglobin, a vision screening, or hearing screening. Next, we're going to go ahead and set our recall date. Generally, we do recommend at least a couple of weeks ahead to give your patients enough time to schedule an appointment. Personally, I usually select the first day of the next month coming. Then we can go ahead and click search. Depending on the number of patients in your PDL, this search could take quite a bit of time. Running during a lunch break is a good idea, or any time that you can be away from your desk for a period of time. You do have the ability to stop processing at any point if you choose to do so. This does not cancel your search completely. It will still return a list of all the patients it has found up to that point. After the search is completed or we end it, we have our list of patients that are due or overdue for a well visit. In this case, we have 54. So what stuck with us? We learned how to generate a recall list using the Bright Futures guideline for any age patient due for a well visit. How to recall that patient that qualify for are not yet enrolled in a care plan, and to always set your recall date in the future. Possible action plan for your office, you might want to consider creating a recall list for patients that are behind on their preventative visits. Or create or update the care plans that you have for other conditions that the practice wants to monitor, like asthma, ADHD, weight management, anxiety or depression, or maybe diabetes. Activity 4, creating a vaccine status recall list. This activity will have us create a recall list for patients behind or due for one of their HPV series shots. In this activity, we will be creating a recall list by leveraging OP's backlogic. All practices have access to the backlogic in OP. This is how the system is able to show a series of vaccines as completed or due. As a practice, we want to do the very best we can to keep our kids healthy and up to date on their vaccinations as possible. Having our patients come in for their regular shots that may have been deferred at a well check or other more voluntary immunizations like the flu or HPV shots also helps to keep the practice's revenue streams healthy. Let's see how we can generate this easily by using the DAR. We're going to create a patient demographic list to search using active patients only and at least one visit in the previous 2 years. The time since last visit for this one is less of a set in stone item, I feel, more of a preference by the practice. Some offices will shorten this up to have less patients in the list, owing to the fact that if a patient hasn't been seen for over a year, it's unlikely they might come in for a shot. Others will include with no date restrictions. You know your practice population best, so do what you feel is right for your practice. In this scenario, we're also going to exclude our patients with appointments. We can notify those families when they come into the office. I'm going to go ahead and hop over to OP again. And in my practice management tab, navigate to the DAR. I'm selecting active patients and setting my date as 5/1/18, and I'm excluding my patients with appointments. Now that I've generated my PDL and placed any additional desired filters, I'm going to navigate to the vaccine status recall. First, we'll have to select a forecast status. In this one, we're going to go ahead and select anybody who is behind or due. Next, we'll select our vaccine group. And then finally, a recall date. Depending on the number of patients in your PDL, this search could take quite a bit of time. Running this during a lunch break or a time when you can be away from your computer for a while is generally a good idea. You do again have the ability to stop processing at any point. If you choose to do so, this does not cancel your search completely. It will return whatever list of patients it has found up to that point. So I'm going to go ahead and press search. And yes. And you can see it start analyzing these records. Now, if I come back and I need to get to another area in OP and I can't allow this to continue to process, again, I can go ahead and click my stop processing button at any point in time. And rather than completely canceling, we can see that it does come back with some results. Once our search is completed or we end it, we have our list of patients that are overdue for our HPV shot. What stuck with you? We learned how to generate a recall list for vaccine status based off of OP's unique backlogic. Using this, we can recall patients that are due now or in the future, patients that are behind the schedule, or patients that are a combination of behind or due. These recalls can be based on all vaccines, a specific series, or a single vaccination like a flu shot. A takeaway action plan for your practice to consider. Create recall lists for patients that are behind or due for structured vaccinations. those are going to more often be patients that have deferred a shot from a well visit, or any patients that are behind or due for voluntary vaccinations like flu shots. Activity 5, sending patient messages using the patient message exchange. Our 5th and final activity today will be creating messages for our recalls using the patient message exchange built into OP. This final scenario is taking into consideration what to do with our recall lists once we've generated them. We'll be starting here once the recall list for well visits has been generated. Let's take a look at how the PMX works to separate out and send messages to our patients based on their contact preferences. Once any recall list has been generated, we have several options available to handle contacting the patients or parents on the list. We can print letters, export to a spreadsheet format, or use the built-in messaging function in OP, known as the Patient Message Exchange, or PMX for short. The PMX uses data that we've collected when entering our family contacts to create and send out a recall message based off of the contact preferences we set there. If we haven't set any contact preferences, we also can set defaults in the PMX so we don't miss anyone on our list. Let's take a look at how this works. So once again, I'm navigating to practice management. This time we're going to start with our patient message exchange though. Before we generate any messages, let's take a quick look at how we can configure the system to work best for our practice. From here, we have the ability to create a recall message for each type of contact method, being phone, email, or text. This drop-down message shows all of our drop-down menu shows all of the available items that we have as far as recall or appointment reminder type messages. We can add or edit any of the messages that already are in this list. I'm going to go ahead and say we're doing a preventative recall. Once I've selected the message type, if I go to my telephone, email, text message, or paper mail, I can see those messages and edit them. These messages use a blend of static text and data fields to help you create custom messages for your practice. We also need to set our default contact preferences from here. This is a vital step in the process. The contact method used is based off of the family contact section of OP's demographics. Here we can set how the parent or guardian would prefer to receive notifications from the practice. If that field is blank, we need to set a default for the PMX to try. Otherwise, those parents will be skipped and won't receive a message. We can set a preferred contact method for recalls here. If I click the drop down here under recalls, we see that we have an option for email only, text message only, email or text message, telephone only, email or telephone, text message or telephone, or email or text or telephone. If we select an option that has more than one item that it's going to try, the system will look at the items in order. For example, if I was to select this final option, anytime we send a recall out for families that don't have a preference, it would first look in the email section of the family contact. If that email was blank, it would continue on and look to see if there was a text message item. So if it could had a cell phone in the cell phone spot. If that was also blank, it would then move on to see if there is a telephone number for it to make a phone call. If it comes across data and email, it would stop. If it does not, it will go to text. If it finds data there, it will stop. I am going to select email or text message or telephone, and then set contact preferences. Now let's see how we can use the PMX to send messages once we've generated a recall list. I'm going to go ahead and navigate again to my demographic analysis and recall. And I'm going to go ahead and create a PDL. And I'm going to go ahead and do a care plan recall for patients that are due for a well check. So once you've created your PDL, you can navigate and create a recall list from either the clinical, care plan, or vaccine status recall tabs. And then once your list is generated, so we have 54 patients, we're then going to go ahead and click on our send messages, and this will launch PMX in a separate tab. So I click send messages, and now the patient message exchange is opened. We can see in each of the tabs how the patient messages have been divided. Each of these groups are based on the contact preferences in the family contact or what we previously set in our default contact preferences. We can review these lists from here if we like. Once we're happy with our list, we're going to go ahead and click on Create Messages. This will now send out the messages under each tab here using the message preference that was selected. I go ahead and say OK. And now all of my telephone, text, and emails are going to be sent out based on our contact preferences. After sending our messages, we are able to track them and see whether or not they've been successful by using the Messages Sent tab. This can be sorted and filtered by date, contact method, and whether the contact was successful. So what stuck with you? In this final activity, we learned how to send a message to our recall list using the patient message exchange. We learned that messages are generated based on family contact or system defaulted contact preferences. We learned that the PMX can make phone calls, texts, or emails, that messages within the PMX are customizable, and that we can track messages that have been sent using the PMX. A takeaway action plan for your practice to consider. Review the patient message exchange configurations for recall messages. Do you have a recall message? And what does that recall message look like? Right? So what does our phone message look like? What does the text message say? What's in the email message? Also, make sure to set your default contact preferences to ensure contacts that have no preferences set are not skipped when we send out a recall. On the next two slides, I've included some resources for you for our Help Center. On the next slide, we have our Help Center videos and webinar resources. If we click on any of these links, it'll take us out to the Help Center based on what we have listed here. As you can see, the first one is our OP live group trainings. We have a clinical reports training set for Tuesday, May 5th that will go over a lot of the things that we've talked about here. So if you wanted to see more about using the DAR to create clinical reports, go ahead and register there. We also have the OP Educational Experience 2020 in our menu to the left. And if we navigate to the Q2, Navigating Your Practice's New Normal, we'll be able to see the webinar series that we performed this week. We have Corinne's, Jenna's, Kim's, Mary's, Kristen's, and mine that will all be available here if you wanted to take a look at the recording for any that you might have missed, or to download the slide decks that we were able to show during these presentations. Our mission here at OP is improving health through technology. We are committed to providing you and your practice the best pediatric technology resources and community to drive your practice success and quality patient outcomes. I want to thank you for your valuable time during this educational experience to create recalls using the DAR. I would also like to thank you all for doing what you've been doing during this time of trouble in our world. Everything that you do to serve our communities and the families in them deserves to be recognized and praised. Thank you all and have a great weekend. I appreciate your attending.